Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is October 16th, 2020. As always, we start with the COVID-19 statistics. Worldwide, we have over 39 million cases and over 1.1 million deaths. In the United States, we have over 8.2 million cases and over 223,000 deaths. This week brought us a number of somewhat conflicting reports about COVID-19, so I want to start by cutting through some of that confusion. First, a few new studies found that antibodies for COVID-19 can last up to 7 months. That's the longest they've been able to track it so far, just because the virus is fairly new. But scientists with these studies estimate that it could possibly, the immunity could possibly last up to 2 years. Previous studies showed that the antibodies fade after just a couple of months. At the same time, however, we've seen a couple of cases in the United States of people becoming reinfected with COVID-19 just a few months after the first time they fought it. In both instances, the symptoms were worse the second time. Scientists say these reinfections are probably rare, but they're still more widespread than what we've been currently detecting. So what does this mean? Well, like we've mentioned multiple times before in these reports, we don't yet have all the answers. It looks like some people have longer lasting immunity than others, but we don't know why or what makes a person more immune or less immune. The studies that show the longer lasting immunity were also small studies, so we need more data to back up their findings. Like we said last week, it's best to play it safe and assume that you're not immune. Keep following those CDC guidelines. Hopefully we'll get more concrete information soon. Another couple of studies came out this week that suggest people with type O blood may have a lower risk of getting COVID-19 and a lower risk of severe symptoms if they do get it. Earlier studies, we mentioned these in some of the earlier weekly reports, but those earlier studies suggested the same thing, but then studies later on refuted that. So what does it mean for us? We're still not completely sure who's right here, or if there's something in the middle. We don't know. Since the difference between blood type O people and people with other blood types is very small, even in these latest studies, it won't really affect us right now. It's something that scientists need to research further. Eventually, maybe we'll be able to do something with it, find some way to beat COVID-19 better with this information. But as of right now, it's more of a medical curiosity than anything else. A drug trial by the World Health Organization found that Remdesivir doesn't actually help. This conflicts with earlier studies that showed Remdesivir could reduce a person's recovery time by up to 5 days. This new study has not been peer-reviewed, so we may find that there are discrepancies in the testing, so we're just waiting on that peer review. However, this study did have more patients involved than previous studies, and it wasn't sponsored by the manufacturer of Remdesivir, like at least one of the other studies was. Hopefully, researchers will be able to look over all the studies, find the differences between them, and how they were done, or what types of patients they had in the studies, etc., and determine what the real truth about Remdesivir is. Another bit of news that people may be confused about is the Great Barrington Declaration. That's been floating around social media, and apparently President Trump is also a fan of this declaration. The Great Barrington Declaration has been signed by over 10,000 medical and public health scientists and 26,000 doctors. Its main point is that lockdowns are doing more harm than good, and we should just let herd immunity take its course while trying to protect the vulnerable. Dr. Fauci has said that this declaration is total nonsense, and the head of the World Health Organization went so far as to say that relying on herd immunity is unethical. As with most bad ideas that gain a lot of support, this declaration has a few truths and good ideas interspersed with a ton of bad. So let's pick it apart and see what's actually happening here. First, it's true that lockdowns have caused a lot of issues, from loss of jobs to increased domestic violence, and from issues with children's education to increased drug and alcohol addictions. We have seen all sorts of problems since the lockdowns first started. Even depending on the different levels of lockdown that we've seen throughout the world, all levels of lockdown seem to have some sort of negative consequences. What's unclear, however, is whether these consequences are worse than COVID-19 itself. Considering the terrible cost of COVID-19, it's unlikely that the consequences of the lockdowns are worse than it. The world has lost over 1 million people, and probably millions of others have long-term side effects due to COVID-19. Some scientists estimate that if lockdown measures hadn't been taken when they were, we'd have lost another 500,000 by now. Other scientists have estimated that if lockdowns had been quicker and stricter at the beginning, COVID-19 deaths would only be about half of what they currently are. Additionally, no countries in the world currently have a true lockdown in place. Many countries, states, counties, cities have specific laws in place that restrict certain activities or mandate certain precautions, such as wearing a mask, but no place requires people to stay in their homes 24/7 or anything even close to that, really. Early in the pandemic, we did see those types of lockdowns across the world, but that's no longer the case. Any restrictions should be based on science, not politics, and that goes both ways. Some governments are too lax, and others are too strict in certain things. So we talked a lot last week about certain steps to take to protect yourself, and any governmental restrictions should focus on those. Second, herd immunity is a real thing, but that's all that the Declaration gets right about it. The Declaration states that all populations will eventually reach herd immunity with or without a vaccine. That is in no way supported by the current evidence, not even close. The vast majority of studies show that immunity to COVID-19 only lasts a few months in most people, and there have been now quite a few documented cases throughout the world of people getting COVID-19 again after fighting it off the first time. It's no longer assumed that the second time will always be a milder case. In addition, no disease in the last 100 years, when the term herd immunity was first coined, has ever reached herd immunity or even gotten close to it without a vaccine. In fact, diseases like diphtheria, measles, pertussis, polio, and many others had been around for centuries before vaccines were developed for them, and herd immunity never developed, never happened during that time. So if we can't get it in centuries, what makes us think we're going to get it now? As we talked about in a previous report, according to scientists' best estimates, only about 10% of people in the United States have been infected with COVID-19. If it's taken about 10 months to get 10%, even if the speed of infection or the rate of infection is speeding up, it's still going to take years, at least 2 to 3 years, to get to the minimum 60% for herd immunity, assuming we don't have a vaccine. And that's assuming that people stay immune. Right now, it seems like immunity only lasts a few months. And so if that's the case, we'll never reach herd immunity without getting a vaccine that either increases the length of immunity or is able to be given multiple times, but like a booster shot every year, something like that. Even if everything worked out perfectly for herd immunity, given current death rates, over 1 million people would die in the United States alone before we reached herd immunity. We would easily reach over 5 million worldwide deaths in that same period of time. That just isn't acceptable. And it doesn't even count any additional non-COVID deaths, like, for example, deaths from hospitals being overwhelmed. It also doesn't include long-term issues, side effects, negative consequences, things like that, due to COVID-19. So third reason for the declaration not being good is that it calls for a return to normal life for those considered low risk, while high-risk individuals would be isolated. They don't use the term isolated, but they mention a number of things that basically equate to isolation. This is problematic for a number of reasons. First, it would limit people's freedom based solely on age and pre-existing conditions, not based on whether they actually have the virus or in an unbiased fashion like general lockdown does. COVID-19 has a very broad set of risk factors, and so those considered high risk would be a large percentage of the population. In the United States, 1 in 6 people are over the age of 65. Obesity is also considered a high risk factor, and over 40% of the people of the United States are obese. That's not even counting all the other risk factors, such as having cancer, COPD, or HIV, just to name a few. So are we seriously going to place over half the population in a strict lockdown? Obviously, the creators of this declaration didn't think it through to the end. A second reason a return to normal life would be problematic is that the declaration calls for pretty much everything to be reopened with minimal to no restrictions. They specifically mentioned restaurants, schools, music events, and sporting events. They're ignoring the fact that enclosed areas like restaurants are prone to super spreader events, and there have been an increasing number of cases reported at sporting and other events that typically draw large crowds. A final reason that their plan to segregate people based on risk factors is a terrible idea is that even those who are supposedly low risk sometimes experience serious symptoms or even death. We just don't know enough about the virus yet to accurately determine who will be safe and who won't. The last thing I want to mention about this declaration is its claim of many scientists and doctors signing it. 10,000 scientists and 26,000 doctors sounds like a lot, but there are millions of health scientists and doctors around the world. The percentage of health scientists and doctors who sign this declaration is minuscule. Nearly all public health officials, health scientists, and doctors agree that this declaration is a terrible idea. Instead of following this declaration's suggestions, it makes a lot more sense to just implement the common sense guidelines that the CDC has been pushing for quite a while now. Those guidelines have actually been shown to work, unlike the declaration suggestions. And the CDC guidelines don't even require lockdowns. In other news this week, we have 2 recalls. One is for metformin, a diabetes drug, and the other is an expansion of the dog food recall that we mentioned before. So please see the links below the video for more information on those recalls. Thank you for watching the Plain English Public Health Weekly Report for October 16th, 2020. As always, the links below the video have additional information that we weren't able to get to today, and even more information on what we did talk about today. I'm Richard Greenland, and you have a healthy weekend.